Good afternoon, everyone. In the next 10 minutes, I will show you my progress on my PhD topic, heart rate variability in anxiety disorder. My name is Tamás Óvári, and I'm a psychiatry resident and a first-year PhD student. We have two ongoing projects. The first will show us the correlation or connection between heart rate variability and the anxiety scales, and the second will compare the different therapeutic approaches in anxiety disorder. So the first is investigating the correlation between heart rate variability and anxiety severity as measured by standardized anxiety scales. Anxiety is the most prevalent mental condition worldwide, and currently, to diagnose this disease, we still use scores and doctors' expertise, which can be influenced by personal interpretation, so we need an objective diagnostic method. We know that patients with anxiety disorders have heart rate variability of different nature than healthy individuals, so it could be a useful method to diagnose patients with anxiety. In that case, our aim is investigating the effectiveness and accuracy of the heart rate variability in patients with anxiety. But what is heart rate variability? It's a time intervals between the successive heartbeats. It's a dynamic balance which can answer the mental stressor, mental load, and other physiological factors. And it contains three domains: the time, frequency, and non-linear domain. So in that case, we came up with a clinical question: how does heart rate variability correlate with anxiety severity as measured by standardized anxiety scales among different populations? We used the PFO framework to prove our hypothesis. Patients with anxiety exhibit lower heart rate variability, which corresponds to higher scores on a validated scales. For this research, we use two domains. The first shows us the scales, and the second will show us the HRV parameters. We catch more than 10,000 references, and after the duplicate removal and title abstract selection, we found 71 eligible full text. And to expand our pool, we ran the citation chaser, and we found 8 more articles which we can include our analysis. So I would like to show our results. Here you will see the connection between heart rate variability and the anxiety severity using the Beck anxiety inventory. The Beck anxiety inventory is a self-reported scale which focusing just on the somatic symptoms. If you have a higher point on these scales, your anxiety level is higher too. In most cases, we found non-significant results with high heterogeneity, but the direction was inverse. So I will zoom on the low frequency and high frequency domain. In first case, the low frequency, based on 11 cross-sectional studies, show us huge heterogeneity with borderline significance. And the second case, we can find moderate heterogeneity and statistically significant results. So it proves us if you have a higher anxiety level, your heart rate variability will be reduced. In the second case, we compare the HRV domains with the Hamilton Anxiety Rating Scale, which is a clinician-rated scale. And this scale focusing not just on the somatic symptoms, it shows us the cognitive symptoms of anxiety, so it's more sensitive. In that case, we found the inverse correlation, and especially in the high frequency domain, it has a huge heterogeneity, but except one study, the direction always inverse, so it can prove our hypothesis. The higher anxiety level indicate lower heart rate variability. And in the last inventory, the state rate anxiety inventory, we found a similar. This scale is self-reported, but it has two subscales. The state, which shows the current level of the anxiety, and the trait, which shows the long-term vulnerability. We found the same direction and with a high heterogeneity, but I would like to highlight in that case the LF-HF ratio, which shows the positive effect size with moderate heterogeneity. It's caused by sympathetic influence in acute anxiety phase. In conclude, we have some strength and limitation. Our strength is, this is the first meta-analysis in this topic, which is a scale-specific and use multidimensional HRV analysis. And we have some limitation. We use just the cross-sectional studies, and we don't have standardized method, so we have a high heterogeneity in every case. Our conclusion, we find a weak to moderate correlation, so HRV cannot be recommended for routine clinical practice alone in psychiatry, but these indicators may be used as an additional objective tool for anxiety severity evaluation. And our implication for research, we need larger prospective studies with standardized protocols. So from the last progress report, we finished the data extraction and the risk of bias assessment. We have some figures, and we started the grading process. And I would like to jump at the second project, comparing different therapeutic approaches for the management of anxiety disorders. Currently, we have three treatment approaches: the single pharmacotherapy, the CBT, or the combined treatment. Our aim to find the best therapeutic option for patients with anxiety disorder. In that case, our clinical question is which therapeutic approach is the most effective and safe in reducing the severity levels of anxiety. We use the PICO framework to prove our hypothesis, which is combined treatment is more safe and effective in reducing the level of anxiety comparing the pharmacotherapy or CBT alone. And if we answer that, we will have a tailored, more effective anxiety treatment. So we have two ongoing projects which will help us to understand and manage the anxiety disorder. And I must tell, anxiety usually leaves the patient in a dark, so I would like to close my presentation with this quote from Albus Dumbledore: "Happiness can be found even in the darkest of times if one only remembers to turn on the light." Thank you for your attention.
Thank you so much, Tamás, for the presentation. Any questions from the committee?
Thank you for your presentation. I was wondering if you are planning to do a subgroup analysis and separate women to men, because it tends to women has more anxiety disorders.
Thank you for your question. It is a very good question, because usually the women affected more with anxiety, so we should perform this subgroup analysis, but at this point we don't have enough data to perform that.
Thank you. Can I ask another question?
Of course.
If did you see any underlying disease next to the anxiety disorder that can affect the anxiety?
This is one of the reasons our high heterogeneity, because anxiety usually has some comorbidity like depression or other psychiatric condition. So it can be a serious confounding factor in that case.
Thank you.
Thank you.
Thank you very much for your lovely presentation. I'm just interested, following to the question about gender specific. What about like region or country specific? I mean, the article themselves, I guess that they do mention which country does the patient taken from. I'm just curious if you may have some insight about if there are specific region or country which has more or less anxiety, or you could explain about that.
It's a correct and accurate question, but at this point we don't monitoring that subgroups.
Thank you.
Tamás, can you clarify two things for me? The first is, are the correlations between severity of anxiety or the prevalence of anxiety?
It's a severity of anxiety.
So it correlates well. As the heart rate variability is going down, the severity score tends to go up.
It's correct.
And if you have significant correlations, why is your conclusion that we shouldn't use HRV in clinical practice? Could you elaborate on that?
We can implement it in the practice as an additional tool, but our results was weak and our heterogeneity is very high, so I can't recommend it alone.
So what kind of sensitivity analysis would help you make a stronger conclusion?
Interesting question. I will discuss it with my supervisors and I will let you know the answer.
Last question. Yeah, one more. Excellent presentation, thank you. Do you think breath rate compounds or confounds HRV? Did you see anything in the data?
It's a great question. The breathing can confound our results, especially the high frequency domain, so we should control it during the measurements.
Thank you.
Thank you so much for the active
a
short question.
I will try to make it short. It's a little bit connected to what Janelle asked. Like, as I understood, when you showed the forest plots, that you compare, so there is no parameter that tells you the exact level of anxiety. It's self-reported. So why isn't it just easier to ask the patient how stressed out you are? I mean, you can only check heart rate variability if it's reliable based on self-reported measurements, right?
It's right. An excellent question. So we use the scales and our expertise on the field. So we have some protocols to identify this disease, but it will always be subjective if we use this method.
And how can you make it not subjective? Because there is no... So, I mean, if this is the only parameter, how you can only compare it to subjective parameters?
It's true, if we have enough data, we can implement the HRV in the routine practice, and maybe it will help.
Thank you.
Thank you.